everyone. This is our second attachment conversation of this semester. الأسبوع اللي فات we had Maryam Aziz. We were talking about the role of attachment in sexual relationships. It feels كده like today is also a very nice continuation of the topic of couples. I'm very happy to welcome Maryam Maafa with us today. She is a psychotherapist who got her master's in counseling psychology from AUC. She's also certified. She works with individuals, couples, and families. She's certified in emotionally focused therapy, and she's currently a supervisor candidate. And she's trained in internal family systems level 1. So she'll tell us about all these wonderful credentials and how you use different modalities in therapy. So I want to welcome you. I'm very happy that you're joining us. Maryam has been a colleague يعني في البروجرام. احنا دفعات مختلفة بس يعني كنا ورا بعض على طول في الماسترز, and she's been doing an amazing job with couples من ساعتها. I'm very happy that you're with us.
أنا كمان I'm so excited إن أنا have a part of the attachment lab conversations. I'm so excited من أول ما ابتدى. يعني it's like a dream for all of us.
Thank you. It is الحمد لله يعني deep conversations كده about topics that I feel we need to talk more about. I'm looking forward to our discussion النهارده.
أنا كمان.
Can we start by you telling us كده إيه اللي خلاكي to branch out شوية from individuals and to focus more on couples to start with?
So I graduated in 2013 and I started practicing. There wasn't a lot of therapists in Egypt, and I started working. The most common thing was CBT and DBT. I was reading a lot. I was trying to work on myself, and I started working a lot with anxiety and depression. I wanted to work with kids, and then there was a part of me that used to get frustrated from the parents. And my husband's a pediatrician. But then I felt like there was something I couldn't really relate to the parents, and I felt like there's something I need to work on. And so I said, "Khalas, I'll work with adults." And I started working with adults, and I started working with anxiety and depression. They're getting really good, and then they come back. The clients that come back, I became curious. Why are they coming back? And as they started coming back, I realized that their anxiety and depression started to increase based on their relationships. And I'm like, oh, then I think I need to start looking into training into working with couples. And so I was it was pretty challenging back in the day. You had to travel to go get training and all of that. So there wasn't not much online training, and whatever training was available, I would just go to. At Egypt, Jamat al-Qahira, I would do a lot of trainings, Cairo University. And then eventually I was so lucky that some trainings started to go online. And I was introduced to emotionally focused therapy, and I started working with that. And emotionally focused therapy really is strong on attachment. When I was studying at AUC, I was very interested in the attachment theory, and I really believed in it. But a lot of the things that used to just really challenge me as I was struggling, like I like the DSM. I don't mean anything. I respect people's work, but I felt like it put people in boxes and labels. And that sort of made you stuck with not everyone's identical. You just have to understand. And attachment really helped. So what I loved about EFT, there's a lot of work that you have to do on yourself in order to understand that. So luckily enough, my husband was nice enough to join me in a homely type workshop so that we understand our dynamics. So it was great, very supportive. So I was really lucky to have that. And when I started working with couples, I realized how it works on an interpersonal level and like intra and interpersonal level. And it's a lot faster. And so when people would call me if they have a depression or anxiety, I tell them, how's your relationship? Oh, not really great. Why don't you come in as a couple? It's a lot faster. It works a lot more dynamic, like it's more dynamic. And they get to have the corrective emotional experience with their partners rather than for me. And so it takes a lot of work. It's a very challenging, in paper it's great, but if you don't work on yourself and really do the role plays during the training, it's pretty much impossible.
Yeah.
So it's one of those things, if you read it, you just can't, you have to, a lot of the therapies that I fell in love with are the very experiential therapy, which include the mind, cognition, the body, and like a lot of what's stored in our body and what's going on internally. And we talk about attachment, Yani. So this is how it led, and then it led into family work. So if a teenager is having a problem, I'm not trained in play therapy, but even now if someone tells me their child has a problem, their teenager has a problem, I usually refer them to family therapy. because 1 hour of therapy for a child is not the same when you work on the family dynamics. It's very powerful.
Yeah.
It's that simple.
هلا وانت بتقولي كده I'm thinking انه بقى في shift قوي في ال types of modalities اللي بقينا we study and we focus on لانه وقت ما احنا كنا في البروجرام there was a very high emphasis فعلا on CBT and ZBT which is great because it works for some people بس بقى في اكتر فعلا shift towards other therapies and it's great that you were able to take that path as well. طيب for us to start how about we define كده يعني ايه secure and healthy relationship for a couple? How does that look like?
So a secure and healthy relationship is really about repair. Is that even though they might have a conflict, they can repair. They could check in with each other when things change. You know, relationships, it's a journey. It's a tough journey. You get married, maybe a loved one is ill, someone passes away, someone loses a job. There's a lot of ups and downs. But how can they bid each other for connection? How can they talk to each other? How can it's okay if they fight in a healthy way, disagree and agree? How do they meet those challenges? Sometimes values shift. We're human. They're able to really talk about things and find ways to make things happen.
That's very nice.
Yeah.
I like how you emphasize على فكرة repair because repair يعني can be rupture.
Yes.
ف it doesn't mean إنه the couple has been إنه كل حاجة has been very smooth but the fact that there is repair is amazing. Which brings me to another question. Do you think all couples are capable of repair? And what makes a couple more or less likely to be able to do that?
I believe everyone's capable of repair.
Okay.
I really do. It depends on varying degrees and it depends on their patience and tolerance. But when you help them see what it's like to take someone else's perspectives, because we're very limited as humans, we always think everyone feels the same. We do, people should, but including me, like sometimes you have to stop and look outside. Like, how would I know what's best? You know, they know. It's how do they learn to understand themselves?
Okay.
So if they're able to tap into them, this is when they're able to really repair.
And when you talk about attachment and its role in EFT بالذات, how do you see in the therapy room إنه individuals' attachment histories and childhood experiences بيبانوا في ال couple dynamic? ممكن ده يبقى ازاي? Can you give us examples?
Right. So a lot of times when I see a couple, I really hear what each one's saying. So you could hear really simply the attachment language that they use, so how they see themselves, how do they see the outer world. So the view of self and view of other is really based on how safe and secure they grew up.
Yeah.
So if I'm confident, I trust myself, I have a good image of myself, and I have a healthy, trusting relationship with others, not blindly trusting and not constantly not trusting people, this tells me someone's secure. Usually secure people don't come to therapy, right? So it's usually the insecure. And most of the time how it shows up is either two couples come in, they're both avoidant. This is one way it shows up, but usually there's one person who's more avoidant and the other one, you're calling it resistant, I know in your research, or resistant anxious and avoidant anxious. There's one that's burnt out. So the other resistant anxious could be really burnt out. After a while, when anxiously attached is really burnt out, they become avoidant. And when the avoidant becomes really burnt out, becomes anxious. Or so sometimes they either come both avoidant, and that's really tough to get the fight. We want them to be having that fight, the escalation, to help de-escalate. Or one person is pursuing and anxious and the other one is withdrawn and avoidant. Or they're both highly escalated, where most likely the avoidant is burnt out.
طب عايزة follow up على حاجة you were just saying. You're saying إنه when things escalate, avoidant will become more anxious and anxious will become more avoidant.
No, they could be escalated, but sometimes with so many ruptures, it depends how they come. So they can come both like in an avoidant way, but there's one who's more avoidant, but most likely another one is burnt out, so they become avoidant. خلاص مش هتكلم. You know, because one of the things in therapy, the person who's resistant, they're the ones that are pursuing. أنا عايزة حل ما تيجي نتكلم. And the more هي هتزعق, this is usually more common in women, 75% of the time. The man would be مش دلوقتي مش عايزة أرجع البيت طب بلاش نتكلم. And her intention is to really fix the problem right now so we don't lose the relationship. His intention is let's not talk now, let's not fight, let's be good to protect the relationship.
Yes. طيب انت هنا بتتكلمي على the avoidant anxious trap which we talk about a lot of the time and in my classes we cover this كتير كمان في حتة ال relationships. Why do you think أصلا this is a very common dynamic? يعني why do people usually end up attracting someone who anxious end up attracting someone who's avoidant and avoidant tend to attract someone who's anxious? ليه ده dynamic that's common?
Because unconsciously, most likely they're attracted to their attachment figure.
Okay, can you elaborate on that?
So like if someone's anxious, most likely they had a parent who's very avoidant, that they're very like it feels like home. Or if someone is avoidant and they're used to having a very anxious mother who's shouting, will be attracted they will feel like it's normal. مامتي بتزعق مراتي بتزعق even though they don't like it, it just becomes normal.
Yeah. Right. And then they end up going into the same patterns again. وبعدين يحصل this escalation.
What happens is several ruptures. The problem is with time, one of the things about our eye contact is sometimes with so many not being able to fix and repair, you could be in the same room with your partner, you know, and they look at each other without even a fight, it's already escalated because your brain stores a lot of things and we're that limited in that way when we don't repair.
Yeah.
Oh, he's out to get me. Oh, he's gonna ignore me right now. إذا أنت قصدك إيه لما تمشي وتسيبني وأنا قاعدة, right? And هي حتزعق لا مش هروح على وقت النوم. So there's that where your brain just automatically and your body feels threatened because there's no repair or corrective emotional experience.
طيب in therapy when you see that dynamic happening بالذات لو في كمان relational trauma يعني it's one thing if we're talking about attachment styles وفي بقى the aspect of trauma كمان ال relational trauma لو كمان أكتر شوية موجودة. If you see this dynamic happening ما بين ال individuals نفسهم ما بين the partners, how can you help them distinguish ما بين إنه this is your partner who's saying that now and it might be coming from different places وما بين إنه that is triggering something from your childhood? How do you do that individual work في context الcouple?
Right, so the first phase in couples therapy is de-escalation. So what I do is like I help slow them down and help them use the language of what triggered them, which made them go to fight, flight, freeze. So it's a roll of an eye, or he gave me his back, right? فلما عمل كده أنا مش مهمة, هو مش طايقني, أنا مش عايزك, فببقى angry. أنت ليه ما بتبصليش? She becomes defensive, and I'm like, okay, and how does that feel in your body? بغلي من جوه. Okay, can we stay a little bit there? What does it mean, and what if he doesn't want to be with me, right? But once there's de-escalation and they understand each other's trigger, وهو ممكن يكون تون صوتها بصة معينة triggered them فيبتدي يقول هتزعق لي تاني and I feel disrespected. إيه ده أنا بقفل, how do you feel? لا مفيش حاجة في جسمي عمالة أفكر. She doesn't appreciate me, so he shuts down more. And once they start realizing they're fighting for the same, she's shouting and trying to protect, وهو he's avoiding to make sure that they don't fight to protect. فده بيحسسهم بالأمان. إيه إحنا عايزين نفس الحاجة. Once the de-escalation happens, then we go in the second stage, is what we call reframe, attachment reframe. And so they're able to explain their unmet needs. And usually when they can go into a deeper place in their body, which I sort of help hold with them. And I would ask simple things, and how do you see yourself in that moment? And they could say something like, I'm a really horrible person, I wouldn't even stand myself. أصلاً لو أنا بزعق بالطريقة دي, all I need is, but I'm like, okay, could you say that to your partner? No, if I say that, he'll see that I'm weak, and he wouldn't want to be with me. It's just that. So we tap down when they're ready, when they're both de-escalated, when they feel like we're in it, we have the same thing, we're fighting for this. So they could drop down more into
the
body.
vulnerability.
Yeah, and the vulnerability really comes when we drop into our body, and sometimes, and does that remind you of something? And they're able to say like how, like maybe a parent would shout at them at a certain thing, so they can't shout back, so they keep quiet. وهم مظلومين في حاجة. So like they could, like memories come up and images and visualizations come up.
Very, very interesting. حصلت قبل كده إنه you work with a couple مثلا and you're trying to do that and it doesn't go very smoothly and you feel like one of them needs to go to individual therapy and you refer someone إنه لا, you need to do your own work. إمتى بتحسي إنه this is something that you need to do?
A lot of times when there's addictions, mostly.
Okay.
Yeah, because sometimes there could be more deeper things, and that it's hard for the partner. I mean, it's unfair for the partner that is struggling with addiction also to go deeper and leaving her like hanging. So I would refer them out. Early when I started practicing, I used to do it a lot more, but right now I think I have gained a lot more confidence and more tools to be able to hold that.
Okay.
Yeah.
طيب, you as the therapist in the room, your own attachment background definitely can also come in في الديناميك ده. حتى with individuals, and it happens with us all the time. And you mentioned في الأول فكرة إنه we have to do our own work, you have to be very conscious and mindful of what you're bringing in the room as well. بما إنه many of the attendees are students who might be interested to pursue that line of work, would you like to say anything about that? And from your experience, how do you handle this? How do you go around?
Right, so one of the things when I graduated, like I said, there wasn't much. We don't have a licensing board, or we do, and it's not really efficient in Egypt. So I went into forums in the States. Okay, what do therapists need? So one of the things you need to be doing is doing constant training. And right now, like it's been, I've been practicing since 2013. Every year I'm training in something. So I'm finishing this year's somatic experiencing. I started training in psychodrama. So whatever you can do is you need to really. And when you do the training, you need to be the client, which is really powerful. So one of the things, yes, I do get triggered. I'm human. I do get attacked by my clients. And being able to take a breath and realize, and slow down and, you get clients who attack you or a couple or you're on his side. But I remember at one point I got really triggered by a couple. I use this a lot, this example. والراجل قال لي هي like الست كانت بتزن عليه على بنتها she's a teenager ما كلتيش الكرواسون اللي انا جبته لك ما كلتي فالراجل زعق لها فقلت له طب وانت زعقت لها ليه ايه اللي حصل هي زنانه ما بتسمعش الكلام والست لازم تطيع جوزها he said that I got really triggered I'm not a feminist but I don't like unfair treatment. I took a deep breath and I said wow I get that. You really want her to listen. And what is it like when your wife doesn't listen? It's like I feel like we're going to lose our daughter and I want her to really take care of her. She's a teenager. We're not going to fight. We need to choose our battles. Wow. Right? But if I had told him, what the hell are you, part of it's like, but it's really like you need to be able to regulate and really check in with yourself. And it's that simple. Just take a breather. Can we just take a deep breath here right now and just reflect it back. So it takes a lot of work. I don't think they noticed I got triggered, but after the session I needed some time to recuperate. It's very triggering.
وممكن تحصل إنه you find yourself very triggered by one of the partners and you really can't get where they're coming from أو مش قادرة أو يعني حد منهم you're not able to see أوي their point. Does it happen إنه ممكن يحصل كده?
Yeah, but I'd be more curious.
Okay.
So curiosity is key, is asking more questions, help me understand, what are you frustrated from? And maybe one of the reasons like I'm starting to introduce IFS is sometimes it has a different language. Okay, you have an angry part. No, I'm not angry, but you're shouting. People when they're angry, they don't notice. No, I'm not shouting. Okay, so what is this angry part trying to say? Help me understand. What is it trying to do? It's trying to protect me from what? That my husband doesn't hurt me. Oh, of course. I wonder if your husband knows that. So like there are ways, being curious, having more interventions, because I always remind myself when I work with couples, I see the little kids, like as if they're two little kids inside, and so there's something they're fighting for. They want each other, right? And it's heartbreaking to see a couple, they're in love and they got married and weddings, and all of a sudden people come to therapy when it's the last resort.
طب following up on what you're saying إنه هما الاثنين عايزين كده هما الاثنين عايزين يكونوا مع بعض and they're trying to say that in different ways. What if you have partners who are in different places? Someone who's here because هي جرتني هنا وقالت لي إن إحنا لازم نعمل كده أو whether that's the woman or the man. وحد who's really trying to fight for this and trying to make it work, but someone else who's resistant and does not really want to be here because this is also a common dynamic.
Right. This used to be really early on common for a lot of men. Women make the calls. Actually, most of the calls right now when they want couples, they're men because they hear from their friends. So what happens is once they understand, I'm not there to judge anyone. Once they understand, I am their process consultant. I take the relationship, once they learn that I help them express, it's sort of, they're in there for like, they feel there's hope. So I've seen it a lot with men, and where they learn to express it, and then what is it like that now he can express and tell you, لا it's not بس انتي جيتي قلتي, you said it. I don't want, if you can get him to talk, I'm gonna stay. And now he's talking, what is that? And it's just like, oh yeah, he is. And it sort of really gives that reassurance, right? And it's the same way, sometimes people are separated and, okay, I'm coming, you need to resolve it in this session, and we start talking, and as they hold themselves accountable, as I sometimes psychoeducate, I say if there's one person who's securely attached, you guys won't be here. And I want to be here to help you both. This is going to help you, and it's going to help your relationship with your kids. Because, and that's why I love couples work. When you help a couple, it impacts the whole family.
Yeah, that's true. Do you feel that there are any cultural aspects that affect relationships عامة for most of the couples that you're working with? Obviously you work with different cultures كمان, but in terms of cultural differences, because in the lab this is one of the things we kind of focus on شوية, اللي هو what does the culture bring in, and what are some stereotypes وكده, because this can be a strength-based approach, and it can also be a barrier sometimes. Do you see that culture has any role in, especially with couples therapy?
You'd be surprised that I actually ask each partner their culture of their home, which is usually very different, and I feel it's very diverse in Egypt. It's different, like if I worked internationally with different nationalities or religions, and I asked about their culture, and you would think like that's a normal question, but you would need to ask because it's very different. So there's a cultural aspect based on the home. Based on, so it's not real, like I go in not really knowing, and I become curious about their culture, their upbringings. There are certain words they're used that's okay, in that family la. So it's very specific. I wish it could have been more general, but honestly, like
I like that. I like that you bring curiosity into حاجات كتير, because that helps the clients come in, bring in what they want to bring in, so you don't make assumptions من قبل ما تبقي شفتيهم.
Like people celebrate these birthdays and these and other people don't. We don't. And so يعني he didn't get me a birthday gift, but in his home they never did that, you know. So it's very like, it's very diverse.
Yeah. You know, that reminds me of values. عشان أنا عارفة values is also something that you focus on, like what are the values for each one of them وكده, and it's important for couples to have similar values. But since you're also saying that we come from different backgrounds, وكل حد الculture بتاعته لو هي الفامily أو what I know to be familiar, we can come with different values sometimes, and also values change with different life stages. For you as a couples therapist كده, when you're seeing partners, إمتى بتبقي شايفة إنه these are different values بس ده عادي because they're different people, وإمتى differences in values can actually become a big conflict? يعني إمتى this is too much of a difference in terms of values?
So it's true, people, and that's why it's important to check in every year or two with your partner. What are they shifting? And a lot of people come in, you know, like for example, someone got married to someone who's veiled, and she decided to remove the veil, and he made it clear, and he tried, and he can't, and she wants to continue the marriage but doesn't want. She wants to remain not veiled. That is something I cannot do, and it feels very difficult for her, but it's only fair to him. Who am I to judge this is right or wrong? But that's against his values. He wants his wife to be veiled. Does it mean that it's control? No. Is she willing to do something about it? Also, I saw a couple once, she's veiled in a certain way and decided to remove, and for him, the veil is not religion. He comes from one of the different cities out of Cairo, and for them, it's part of the culture more than the religion to be veiled. And when she understood that this was important, she was willing to keep the veil. So, but, you know, this is one thing. Or someone married someone who doesn't drink and then started drinking. Who's going to accept it, who's not? Like, there's a lot of, like, discussions. I really can't judge what's right or wrong. They have to be able to come to that decision. And a lot of times it's difficult for a lot of people, and then a lot of times it's fine.
So it's up to them whether they accept the difference ولا لا. That's what you're trying to say.
Yeah.
Okay. Like, since you use different approaches, EFT, YFS, you mentioned psychodrama and somatic experiencing stuff. Can you tell us a little bit about how these come together and what do you focus on for كل حاجة منهم? Because many again of the attendees might be interested in different modalities?
So I really like experiential therapy. It's very powerful. Our body knows a lot more than our brain. Our brain is quite limited. And it's really like mind-blowing when my clients can tap into their body. Because when you're in your head, you don't know. You think you know, but actually your body knows more. A lot of the trapped negative experiences. So whatever I use EFT mainly, and I use IFS or IFO. I'm not trained in IFIO, which is the couples therapy for IFS, but I use a lot of the interventions there to help give them other ways to really express themselves. Newly trained in psychodrama, I would use it more in family therapy. I'm guessing like I could, if I'm working with a teenager and his dad, I would ask them to switch seats and what would your dad say if you're in his. So this was something that would also help see perspectives, different perspectives. Also, IFS does the same with different parts of the personality.
Can you elaborate on the parts? Because I'm not sure everyone is familiar with internal family systems. What is the concept of the different parts? And also, how do you see that relating to attachment?
Okay, so IFS is about helping people understand the different parts that came up based on their attachment. So if I'm resistantly attached or anxious attached, I might have a protector that's angry, right? So this is a protector part. It could be a manager, or I might have an exile part that's due to childhood trauma, so I lash out to protect. And then there's a firefighter part, and these parts are mostly related to addictions, whether it's food, excessive shopping, pornography. It's a way of coping, cutting themselves. And so what happens is when a person is securely attached, they have really strong self-energy, and self-energy is composed of 8 C's, which is calm, curious, compassionate, connected. I can't, like, when you list things, I don't always remember all of them. And creative. And so this really helps you be there. But when you have these different parts show up, like when you're triggered, I'm angry, but I'm anxious. This is afraid, and they get stuck between both. And so what we do is help them maybe deal with the strongest one showing up. The minute they can befriend it, it usually goes to a childhood issue and how they could fix it, and images come up, and the body is used as well. And so the more we can attend to every part is important, rather than push it away. The more we push away our fear or our anger, it just shows up more. But the more we befriend it, our self-energy shows up.
Can you give an example, Masan? I think an example would clarify, and how does that dynamic happen in therapy?
Yeah, so I'm working like with a client you guys wouldn't know. I'll change everything about.
Change identifying.
So she's really successful. She's a highly achieving person, and she was working. And every time she works, when someone asks her a question, she gets angry, but people tell her you get angry, but I noticed like her eyes get confused. And so we started working with the confusion. So when she tries to explain something and people don't understand, she gets really, really angry at herself. What did I do wrong? But she didn't know that. But in her system, people see her angry. In her system, she has a confused part, and she has an angry part. And the angry part is about her, not about the others. And the minute we can slow down and see what is that confused part, doesn't understand, why am I angry? Okay, so can we say to that confused part to take a back seat? Can we say, I'm angry because I'm trying to say something and they don't get me. What am I doing wrong? And then we go back to a place where when she does something wrong and she's being told off, and what does she need in that moment? And she can go to a place where her dad's teaching her something and she's doing it the wrong way, and she's really frustrated, but all she wanted is to tell her dad she can't understand what he's saying. And so when there's a lot of that healing, those parts just calm down, and her self-energy, but we continue working on the parts, of course. It's not that simple.
And do you see that there are certain attachment styles that correlate with certain parts؟ يعني بتشوفي مثلا people who are avoidant parts معينة بتبقى أكتر باينة with anxious.
Yeah, the avoidant, I think they have a lot of exiles, but anxious as well. But it plays out differently, and unfortunately, it's really hard to say, because I'm amazed. I don't know what we're doing. I'm blown away when I hear what they take me and the images that come up for them and for those parts. But it gives a lot of hope for the client that they don't see that they're always angry. It's just a part.
It's just a part.
And sometimes it's really blended, and we help them say, okay, you're really angry right now, I'll talk directly to you right now. To help them just see it as a part rather than a whole personality.
Yeah. I love this kind of work, and from an experiential interventions on Maafa, you never know what to expect. It's always, and you're always amazed with what comes up and what can this kind of work do coming from.
Yeah.
It's wonderful. I want to leave enough time for people to ask questions. Any questions? Wow, we have a lot of people. Okay.
Yeah.
So I was wondering, have you ever, like, were you ever put in the situation where you really don't think this is gonna work? إنه خلاص يعني they are maybe still trying and they're coming, but you're like خلاص يعني just leave or just يعني because sometimes deep inside you will feel like this is not working. Like when you were talking about values, they might maybe one of them might like let go, or for example, but other things come in. Like خلاص struggles are every time the same thing and they're repeating, nothing's working. Yeah. Have you ever felt that?
It's a great question. That was with my first couple, and they're doing great.
Oh, really? Okay.
Yeah, they're doing great. So I'm so blessed. I felt, but it was a bit about my confidence. But it was, she had disorganized attachment, and she's just amazing. Like just talking about it right now gives me the shivers, because people with disorganized attachment won't come to therapy unless in a couples situation, and like, yeah, they're doing great. It's been, can't remember how many years, and it was a lot. So yeah, it was that one couple, and that gave me hope. So every time, if I might feel a little, I remember those couple. It's not for me to decide, it's really for them, and I know I can do everything I can. I'll work till the end. I don't give up. Yeah.
I had a question as well. When you mentioned like the different genders and the issues that are most common, because as Dr. Moon said, the mainly it's the anxious attracted to the avoidant and vice versa. And like, I know most men are avoidant and most women are anxious, but I'm speaking about the problems. Like, what would you say the most common problems when in therapy and couples therapy throughout the years that you've seen from both genders?
So it's a great question. Problems are really important, and I listen to them. I really don't focus on what they talk about. I focus on the dynamic, on the trigger, on the fight fleas, on the body reaction, on how they get defensive, their perception. A lot of times their perceptions in their head, they don't speak it out loud. But the common problems they talk about, we're very different now. We like the same things. Well, people are different from day one. They talk about in-laws, that's global. They talk about parenting. They talk about money. They talk about their intimate relationship, which usually is the opposite cycle. The person who's avoidant most likely is more of a pursuer in the intimate relationship, while the pursuer, it becomes the avoidant. And that's where it clicks for them. They could relate to each other. So a lot of the things they talk about are really stories. The stories are just, it's the same fight over and over. It's not about the story. It's about the trigger, the tone, and that's what it is. But this is what they talk about, and it's a global thing. That's why these therapies work worldwide. Right. Thank you for the question. Yeah.
I have a question too. When in therapy we're dealing with attachment styles, if the goal is to help clients, for example, to become more secure or to adapt with their attachment style and understand their partner's attachment style, but they'll constantly get triggered and just learn how to deal with it.
Right, that's a great question. So yeah, the whole point is when they know they're fighting for the same thing and the de-escalation happens, they understand their partner is shouting and fighting to fix things because they're worried, or they're avoiding because they don't want they don't want to lose the relationship. They can drop down to their unmet needs, where they can say, hey, when you're shouting, I get so scared. I just want you to really listen to me. I get so dysregulated. I need you just to tell me calmly, right? I just don't want, or let's pick it up tomorrow. I can't, you're really upset, I get you're upset. And so they're able to do that. Or tell me what you're upset if someone's nervous system can take that. So that becomes a more securely attached person. And one of the things is people come in pointing fingers at each other, but actually the more you tap into yourself and understand yourself, the more you become, like you become very trusting of yourself, and you understand that you're worthy, you understand that you can show up for your partner in a healthy way, try to understand their perspectives, that it's okay that he has a perspective, she has and how do they talk about it? Like it really gives them a different diet. It becomes very secure. So they come out of therapy, I think what you're trying to say, they learn that it's okay to have disagreements and fights, but they learn how to repair.
Can I follow up on that question for a second? Because I'm thinking about the dynamic and when you're trying to help them both understand each other's perspectives and empathize with each other, and you're kind of being neutral وكده. I'm thinking about an example where مثلا infidelity happened, because that can be a bit more tricky. How do you get them to see each other's perspectives if that's what you do, and how do you also remain neutral without one feeling attacked and we're getting you here because we want to, يعني فاهمة قصدي, the
That's
dynamic
right.
is different here. How do you go about
So
that?
one of the things I usually call, I say the injured partner and the person who injured. I don't really label it other than that, so it's not dysregulating. And what usually, it's a different dynamic in a way, is to, usually when there is infidelity, the person who's injured is so angry, it's attacking, and the other person, like, I didn't do this, or avoiding or dismissing, regardless of their attachment. This is how it shows up. And what happens is to really validate the person who's injured. We give them space first, and to really understand, like, the person's trying to understand what, it could be a male or a female. Why did you do this to me? Help me and the person wants to understand, because can I trust this person again? And it's really difficult, and she needs reassurance. And then, but they shut down because for them, oh, I don't want to be when I'm wrong or he's wrong, you know. So what they do is try to shut it down so that it's over. It's very traumatizing for the person who injured. But once they could understand that it's okay, or he or she, the injured partner, is having a difficult time, if we could hold space for that and find ways to be trusting, okay, like we base on agreement, can you keep your phone open, and what we can do. And then when they realize that the person is not telling the truth or trying to avoid the conversation, it's about not remembering what he or she did wrong, gives a little bit of peace to the other person. And the anger, like this anger is coming because every time I remember, I'm so mad, how can I trust? I was living a lie. And the more they can sit in this difficult time, and then eventually we could work with the person who injured. And a lot of times the person who injured thinks it's about the other partner, but it is possible that they're trying to say things but they weren't clear about it, or it's very personal. And a lot of times the deeper we work with that person who injured, really realizes that they've hurt themselves before their partner. And that really is like huge for them when they reach that insight, and it gives a lot of relief. Is it successful? Yeah, but it really is, how long can they withhold the distress? Yes.
I have a question. So there's a part of what you're saying, for example, with the anxious avoidant trap, that would need couples to communicate differently in order for them to kind of get out of this trap and move more towards security, whether that's someone who's leaning more towards avoidance, communicating that they might need more space, or on the other side, just communicating that I need to talk about this because. And I feel like that's very important, and at the same time, since, especially because you mentioned somatic and a lot of other work, I'm thinking a lot of the time someone who is avoidant, for example, this is very much a nervous system defense, and getting out of it and being able to rationally go into a space where you're able to communicate things very rationally to your partner, especially when you're triggered, is not easy, for sure. So I'm wondering, in terms of therapy, is how does that change happen? Is that primarily and only through the corrective experience of therapy and having that safe space? Or, since you mentioned some of the experiential aspects, how do you kind of integrate that into?
It's a great question. So I noticed you use the example of the avoidant. So what happens is when they first come into therapy, the resistant anxious and the avoidant anxious, the resistant actually wants a solution now. And the avoidant doesn't want the escalation. And so what I usually say, this is really difficult for both of you. We're not going to go to fixing right now until we understand the dynamic. And if you can point out your cycle at a session, when you get triggered, you could just tell your partner, relax. This is for me a great thing. This is a good start.
And are they able to?
Yeah, some of them call them the cycles al-wahsh, tornado, like they name it. They understand it's not their partner, it's how the cycle takes over. Because believe it or not, when we get triggered, it's about us, it's not about the other person, it's about our own work. Yeah, sure.
Thank you so much for your talk. This was very inspiring for me because I'm a clinical psychologist and I was trained a lot with adolescents, and I
Yeah.
worked in a family therapy context where it was kind of a different setup, so I wanted to ask a question about this because that's what I remember from my training. So in the setting I knew, it was an adolescent or two, maybe brother or sister, with the two parents, and then we would be two therapists. And so in this work, we would always talk about these dynamics where each of the therapists becomes an object of projection for each one of the members of the group. And so I wonder, if you're doing this alone, how does it feel? How do you adapt? Do you adapt consciously in the moment where you feel, oh, now I identify a lot with her, she identifies a lot with me, now he identifies a lot with me, and do you react? How do you manage these identificational
It's
processes?
a great question. I'd love to have another therapist with me in family therapy. I'd love it. So I don't see a lot of families because it's really hard to schedule at the same time with the challenging appointments in Egypt and people's lifestyles. One of the things I do, it's not really identifying with me. I could identify with each one of them, but what's really important is finding a place where parents really understand. Like one of the things, like if I would I'm working with a family where the son is a teenager, has a lot of anger issues, and the parents think, why are we coming? They have major couples issues, but they don't want to work on it. But then through therapy and through just a few sessions, it's really fast. We realize that the mom has a lot of anger issues. And so we start addressing them. So when she's angry and she starts shouting and he's trying to understand and he doesn't, and the minute she makes sense of her world, she can relate it to her son. And that's where she has more space to really slow down. So it's really important is for the parents to identify what is it like when you don't feel heard, when you don't want to talk and then you keep it and you suppress it and then you explode, right? So once they can identify it as a parent, they can parent a lot better. So it's really crucial. It's about the parents, like helping them do that. And the great thing about families, our parents are naturally in love with their kids. Like they love, like it's an unconditional thing. So once they start seeing it, it's just so powerful and just really quick.
So it comes back to the dynamic of the two, even though it's...
Yeah, and that's why this young man that I worked with, I insisted that his siblings join, and it turns out the siblings as well have anger issues, but they haven't shown up yet, right? But once they see the corrective emotional experience with their brother, it also works for them. It's that powerful. Yeah. Yes.
Hi. So you spoke a bit about in the relationships where one person it gets a bit controlling and another person might feel a bit trapped in the relationship or trapped in general, and this could be triggering for both. So how would you, in a way, not let the person that's feeling that he needs to control, or she, how do you calm that down, and how do you also let the person that might feel they're a bit controlled or like maktoum عليهم in a way, how do you calm both down? And in terms of their not history but like family dynamic, how can you use that to calm both down?
Validation. Once you validate, just like that man, of course you want your wife to listen to you. Help me understand, what does it feel like when your wife doesn't listen? I'm really scared that our daughter, we lose her. She's a teenager. And she was agreeing, she's avoidance. أنا زنانة, أنا مقرفة, أنا زنانة. She doesn't want him to get really angry, right? He's right. I don't take no for any, right? She's calming him down. That means she's afraid. But once you validate, yeah, you have a right. You want your wife to. What does it look? What is it like when your wife doesn't listen to you? What are you afraid would happen, right? And being curious and really the more you validate a person, validation doesn't mean you agree with them. Validation makes the person feel seen and heard. And that's where they can tap into a more deeper, vulnerable place rather than become defensive. Yeah.
And the person that feels a bit trapped in the relationship.
So when he was able to share that with her, I was like, what is it like for you to hear from your husband that he wants you to choose your battles with your teenage daughter rather than you should listen, sit the diablos. She said, I feel like we're a team, but before I felt like it's an oppression. She could say that. She felt safe. But before she was agreeing. Does that make sense? Yeah.
So I really like when you said now validation doesn't mean that you agree with them, because I feel there's this very thin line between both, that you want to validate, but you don't want to enforce something like that, or that it's okay to do so. So how do you phrase the words of validation without sounding like agreeing?
Yeah, so of course for you it's really important that your wife listens to you, right? I didn't validate ست لازم تتجوز. I reframed it. There's a lot of attachment reframes that you can use, which is an intervention. And when I help him use these attachment reframes, he starts using them, right? Of course you want your wife to listen. مش إن أنت عايز مراتك تطيعك. So it's really like a lot of small wordings that could really, help that person. It's called seeding attachment. There's a lot of words that help seed attachment.
I also had a question about, so I'm interested in couples therapy, and you mentioned one of the most important things to do is like self-work and like go to therapy, train. But what else would you say that challenges that you faced and you wish that you've done something different in your training, or what advice would you give to someone who wants to like?
So the minute I have a challenge, I go find a way to get a training in it. And I will train till the day I die. Yeah. So one of the challenges was the intimate relationship for me, for example.
Discussing it with the...
Yeah, because it's a very sensitive topic. Nobody knows. But it's also not about the intimate. It's about the dynamic. It's about a person who's afraid about whether it's the gender. And we don't really talk about it in a sexual way. It goes back to how they go into their head. And because, again, you need to feel safe in your body. So that was a challenge. And I was curious, and I started feeling like maybe I'm lacking something. But the minute I gained trust in that and became more curious, and the more curious you become, you learn things about people that are mind-blowing. Like, how would I know? And that's why they are the experts. I'm just their process consultant. Yeah.
Does supervision also help in that process? Like, aside from training, of course, but do you feel like you have to bring in certain things to supervision, work on your own?
Definitely.
Yeah.
That for sure. Of course, early on I was lucky. My first supervisor was Dr. Yassine Saleh. So I love her. I owe her the world. And so, yeah, I supervise in the different modalities that I do. And of course, early on, when I started practice, I was doing supervision if I could every week or every other week. And now I do it like when there's a complicated, or there could be peer supervision. So it's spaced out a lot more, but I still do need when a situation arises, of course.
Yeah?
I want to go back to the example that you gave about the girl that was very successful, and every time that she would give instructions to people and they didn't understand it, she would feel like it's her fault. I was wondering if just the fact that she knows that it's because of her father and because of what was happening to her like as a child, would that be enough?
No. Because we spoke about, we go back to a certain image that shows up in her body. This is the power of the experiential work. And so like she could see herself, Aga, in her desk. We really like put the vision like as if it's really happening right now. And you could see her body elevate, her breathing gets heavier, and that her dad's trying to explain something and he's gonna start shouting. So she's scared, and what we do is like, how close could you get to her? And it depends like where they're at. I could get really close, I can't get close yet. What are you afraid of? So it really gives you a lot of like insight on where she is with her younger self and her ability. And the minute she could get closer, okay, what would that little girl need? She'd need that her dad wouldn't shout, that she would understand. Okay, how about if you tell her, what would you want to tell her? I would want to tell her, okay, I'm here with you. What would you want to say to your dad? no, I'm not ready yet. Okay, what do you need? And that part of her would say, until eventually she could say, and you could see her body just calm down. It could happen in a session, or it could happen in two. It really depends where she's at and how close she is to that part of herself.
I want to follow up on that question. When you're given that scenario كده of how you're walking the client through that, you as a therapist, you're able to hold the space for her. So you're able to create a safe place for her to be vulnerable, to express how she feels, to go into childhood memories and remember things that might be very triggering. And through that, it is a corrective emotional experience. But in couples therapy, you're not the only factor, or you're not the only person in the room. كمان there is مثلا the partner. فممكن إنه you're holding space and you're being very respectful of what she's saying وكده, and then the partner says a comment that undermines what she's saying, أو يكون very dismissive، أو هو الهبل ده اللي أنت بتقوليه ده يعني وكل ده على كذا whatever يعني dismissive comments. How do you work with that? Because creating that safe space is very important, but in that case you're not the only one who's there.
I would say something along the lines, wow, it seems something that she said is really upsetting you. You have a really good reason to say what you're saying. It seems like it's triggering you. Would it be okay that I could just finish with your wife and get back to you? If he says okay, I do, but I make sure I get back to him when I finish the whole
In
process.
that case, wouldn't she also shut down? Because how can I be vulnerable? It's my partner.
Yeah,
who's
sometimes she's like,
making fun of
Shafti, she would, yeah, you're right. So what I would do is I'd leave what we were talking about and take
Go into the
the
dialogue.
cycle right in the room. I'd love that. I think that's even more powerful. And that happens all the time. And so sometimes they're agreeing, okay, and sometimes they're not. And when they don't, I turn to the other partner, would it be okay? Because it's really, he's really activated, would it be okay? And I'll get back to you. And I had the fume high with him. But I also have to make sure I get back to you. But I take permission. And we have signs for it, like there's a red light, green light, yellow light. Yeah, sure.
I have a follow-up about the intervention that you just mentioned in terms of like a lot of the different modalities that you use. You mentioned kind of, aside from the self-awareness, going back to a certain image and working with that. Can you talk a bit more about what working with that looks like? Does that just mean that the current self is in the picture as well and it's being there for your younger self, or are there other aspects that you use or you change the image based on kind of the issue that you're working with?
Great question, and yes, once we know there's enough self-energy, where how do you feel towards that part that's confused or that's angry? The minute they say, I feel sorry for that part, so if there's compassion, or I'm frustrated from that part. Okay, can we talk about this frustrated part? What's going on? Why is it? So we talk about there's a different part. Once there are the 8 C's that show up, I'm curious about that part, or I like it. Any of those, that there's enough self-energy to go into the deeper work. And you could see the energy of the ball drop into their body. They go more lower in their body. And that's why they can have an image or a memory that's stored in their body. It's not here. A lot of times people tell me, I don't remember. But when you drop it, your body remembers everything.
It's true.
When can you think that you've succeeded with a couple?
Right.
When they stop seeing you, when they are fully dependent, when they say they are happy with the relation. Maybe following up برضه على سؤال مايا, maybe when they end the relationship, that's when you have already succeeded with them. يعني كل حد خلاص خدنا قرار ان كل حد لازم يكمل الريليشن مش هينفع تكمل. When can you tell as a therapist when you have succeeded?
So I usually tell my clients, don't drop out before the third phase. So the first phase is de-escalation. The second phase is reframe, where they could talk about their unmet needs. And the third phase is consolidation, which we could space out our therapy every month or 2. And what happens is we don't go to consolidation until each one has done, for me, it's based on a lot of research in EFT, that each one is able to say that at least 3 times, to go and ask for unmet attachment needs 3 times. And you see the body relax. So that is an indicator, and the consolidation. But they still can come up, like that couple I've worked with, when they had their first child, they come up and it was really funny, they had already repaired. And then when they had their second child, they also came up. And really funny, like I gave them a really late appointment, they had already repaired. So it's that powerful. So yes, you need like at least 3-4 corrective emotional experiences that are really deep, and you can assess and they could tell. Sometimes they say we're good, I know they're not there yet, and I would say.
I have a question about emerging attachment interventions, not even related to couples therapy, but like emerging interventions with disorders. Recently, I was reading studies about attachment styles more. So I want to know both of your perspective on this. For example, if someone is struggling with OCD and like there are studies for using only attachment-focused therapy for their disorder and seeing how it impacts them.
Yeah, so I've worked a lot with OCD and through the attachment perspective, very powerful. Wow, amazing. I've also done, I didn't work a lot with bipolar, but I had one client, I worked with her being curious, and wow, the result, like I wish I could do research on it, like a qualitative research, and especially with someone who is bipolar, maybe she's right now in her 50s and she was bipolar ever since she was in her 20s, and how like she understands her side. It's a way, OCD or any disorder, it's a way of getting away from the distress, right? But once you're curious, once you just help them just understand and show up for them and hold that space, it's just so powerful. And that's their effort, honestly. Like, yes, I do hold space and I do all these interventions. It's their trust in me and, of course, in themselves and how they can eventually do it. It's so powerful.
If I can follow up, is like if they are training for applying attachment interventions for even disorders, or does it come with
I think there is, for sure. But I'm a very curious person, and I am always like, I take risks, and I do a lot of like supervision when it's a new, like before I would have been really scared if I didn't have these trainings to take a bipolar client, but I decided to do that, and I'm so happy I did. Yeah.
So following up on this question, the first thing that came to mind is undiagnosed autism, because I feel like in adults it's not really your typical autistic child that we know all the criteria of it. يعني. if you notice some autistic traits مثلا, how do you deal with them? Do you talk about it, or do you just deal without it without like naming it something?
No, I don't name it, but in that case, this is one case I worked with, and I referred him out. But he was on the autistic spectrum, but he didn't know, and his parents didn't tell, and he was married. And it impacted negatively on their intimate relationship, on a lot of lashing out. But he was really clever in reading her emotions. But it really, like, she struggled with ADHD, but towards like why she came, she was drained, almost exhausted, she just didn't know. And she decided to leave, which I totally understand.
Yeah, but like you don't, because I always ask this question, like with everyone, is like naming the disorders, and like, it's sometimes validating, because you know this is something, this is not just you being weird, or you're being stupid, or you're being whatever. So sometimes therapists would go and, I believe you might have X and Y or something, but on the other side, this is also labeling, and every disorder has their own like baggage with it, and you're autistic, so you have, that's why everything is bad.
Honestly, most of the therapies I work with don't psychopathologize, and that's something I preached for when I was studying. And to be honest, we all have our own ways. We're just human, so we need to have that. And once we put them there, it just, sometimes it helps and sometimes it doesn't, you know? And it's just really holding space for them. Because the more you do, you give them this expansion of their ability of their self. The self is very powerful. Yeah.
I have a question about your years as a couples therapist. If say you have a newlywed or you're sorry about the things you and they say I'm gonna get married.
Yeah.
What one thing would they
My daughter Ade.
What one thing you're gonna be you really
everything is figure-outable, that they should be discussing parenting, money, future goals, that it's okay that they have different goals, that they need to marry someone يكبرهم. And I feel like really lucky, like my husband's here, like we've dated من واحنا صغيرين 16, so like هو كبرني وأنا كبرته يعني. It's a very powerful thing. I'm very blessed. This is something, and it's okay to fight. So it's quite powerful, and he's really helped me grow. Like one of the things he did for me, أنا فاكرة كويس قوي، مرة جه قال لي مريم بقول لك إيه، واحد معايا في النادي يعني احنا مسلمين بس الكنيسة البروتستانت في مصر عندهم very powerful couples program وبيعملوها مرتين في السنة بيعزموا 5 Muslim couples. فهو قال لي would you like to go? He's doing it for me. And it was over a weekend and it was a great experience for both of us. So like he's really looking out for me as much as I am. So this is what you'd want. Yeah. I get emotional because I see couples after they've done the work, it moves you, you know. هم جايين حرب ومرة واحدة vulnerability emotions, it shakes me to the core. If only people knew.
Can I take one last question? Yes.
I wanted to get back to this bodily experience that you really emphasize on. I really appreciate this, and I believe it's very true from a clinical perspective also. And I was wondering, could you say 1 or 2 words about the psychodrama part that is inspiring you? Because I have a training in psychodrama, but it's very clinical and there's a lot of therapists, and then we play with one adolescent or with a group of adolescents, and then we would be again objects of identification of different parts of the personality. So I was just wondering.
So I'm just starting this training, and starting it with a great group of psychodramatists. One of them had a psychodrama group for 40 years, wow. Dr. Maurizio from Italy. And so this is quite new, but the reason I got into it is because of my work with family therapy. So, you know, like the more I start something, like the more you become curious with your clients, the more you have hope, the more you want more into, like it gives you like a more stronger foundation. So honestly, in that area, I'm still new, but I know that this is something that I'd like to work in group setting. I have never worked in a group setting before, except when I was training at AUC, I did a social anxiety group with a colleague of mine. It was part of my internship, but like, and I feel like, okay, why not? So like I'm open to learning new things, but unfortunately I haven't used it a lot yet, but it's very powerful. Yeah.
Wonderful. I hope we were able to get to all the questions. Our time is up. احنا عندنا الساعة 2 and يعني دايما the talks where everyone is still staying after 2, I know, and then we've had quite a great discussion. Thank you so much, Maryam. This was really, really very insightful. I love what you're doing, and I love the reminder بتاع the curiosity and showing up for clients in a certain way, and the belief that relationships are repairable. It gives a lot of hope, and I think it was very insightful for everyone who attended today. Thank you so much for the work you're doing.
Thank you. We all joined. I love the questions. Thank you so much. It just shows how much people are so into this, and I hope you, wishing you all the best of luck. We need more therapists.
Yeah. Yes. Yeah.